Henry Ward Beecher once said, "We should not judge people by their peak of excellence, but by the distance they have traveled from the point where they started."
Our university is based in Barnet, which is located in the northern part of London. Our journey began in September 2019, and although our team faced a lot of challenges as a rookie team, we remained resilient, and through our perseverance, we have now recruited 10 students, developed 2 social projects, and committed over 925 hours to Enactus.
We are a small but close-knit team who share the vision of changing the world for a better and more sustainable future. I'm KT.
I'm Fatima.
I'm Chris.
I'm Saksham.
I'm Pauline.
And we are Enactus Middlesex.
This year, our team achieved
Successful recruitment at Freshers Fairs.
Participated in the annual Fair Trade Fortnight.
Organize a football five-a-side tournament to raise awareness of our team.
We work collaboratively with the University of Greenwich, which is another rookie team in London.
Gave freebies during the week of mental health.
Coordinated and promoted the Design by Nature competition. The purpose of the Design by Nature competition was to raise awareness of environmental sustainability and to inform students about the Sustainable Development Goals and how they can get involved with Enactus. We had 11 participants and the university's new Vice Chancellor and the Mayor of Barnet in attendance.
Our first project is called WeGen, which stands for Wellness Generation, and it fits in with the Sustainable Development Goals, which are 4, quality education, and 3, good health and well-being.
WeGen is aimed at supporting and empowering Barnet youth with low-level mental health issues through our workshop program. Our mission is to challenge the stigma surrounding mental health and start an open conversation with our project. 50% of mental health problems are established by the age of 14, while 75% by the age of 24. Our borough's population of 93,590 children aged 0 to 19 remains the second largest in London, and this group accounts for a quarter of the whole borough's population. Prevention and early intervention is about tackling problems that experienced by little children as early as possible to improve the outcome and to lower costs. A local needs analysis identified that mental health is the third most common problem that drives Barnet families' poor outcomes.
During our discussion with Barnet Wellbeing, we found out that there's a significant amount of social stigma around seeking help for mental health. Local services try their best to look after this type of issue. However, they cannot accumulate the amount of need required. In many cases, people's mental health disorders become worse after experiencing discrimination from society. And unfortunately, that comes from friends, families, and employers. In November, one of our Enactus MDX members collaborated with Rethink Mental Health to train as a well-being hero. He was trained to facilitate mental health and well-being workshops. With Rethink Mental Health, we aim to provide more training for the team members to facilitate the workshops. We then co-designed 4 workshops focused on developing strategies on loneliness, self-care, building resilience, and de-stressing yourself. The workshops will last about an hour and they're designed in the following format. They'll start off with an introduction, ground rules, initial discussion, activity, CBT, and at the end, breathing exercises. In order to tailor our workshops to meet the needs of the best of our ability, we're working to develop our understanding of needs and wants of our potential youth beneficiary group. Our relationship with Barnet allows us to directly communicate with them for advice and guidance whenever we need it. We are currently speaking to 3 partners which are currently on the slide.
We want to reduce the stigma around mental health and make it easier for young people to talk about and make them comfortable attending our workshops. We want young people to understand and be able to use simple cognitive behavior therapy techniques to help them cope with the everyday stresses of life and school and empower the future generation. Better mental health can lead to greater focus of students into study, have a positive impact on the individual's overall fitness, and leads to build healthy and social relationships. The performance measures that we will be calculating are percentage reporting more confidence, percentage reporting lower levels of mental health issues experiencing every day, and percentage reporting increased use of CBT techniques in everyday life. And we'll also be taking into account overall feedback from parents and guardians of the beneficiary regarding change and mental wellness. In the next 3 months, we hope to establish a meeting with at least one of our project partners to discuss our pilot workshops and run an active needs assessment with a beneficiary group. In 6 months, we hope to have established a relationship with a beneficiary group and run a pilot for each of our tailored workshops. In 1 year, we hope to have all of our project partners working with us collaboratively and helping us deliver tailored workshops every week. The tailored workshops that we will run will give users awareness about mental health problems and how common they are, and the tools to track, cope, and deal with some of the challenges they face.
A second project is Relingo. Relingo is derived from the term restarting life with the language. The mission of a project is to provide support to mothers who are asylum seekers in London by helping them to learn English in order to make the process of integration into society, finding employment, and the completion of important legal UK application forms smoother and less stressful.
In our area, there have been multiple case studies that contain stories of women who find it really difficult to integrate into the society, especially coming from cultures that do not provide women complete freedom of being human and are seen as just full-time mothers. Most of the asylum seekers who are currently in our neighborhood come from countries such as Syria, Iran, and Afghanistan. Women in these communities are at a higher risk of isolation. From our understanding, these countries are known to be closed communities where average age of marriage is 24. In Hindon, 60% of ESOL education funding had been cut off, and over 8,000 women do not speak English. Asylum seekers are defined as people who have yet to receive their residency status from the government. Asylum seekers, therefore, to get government benefits are deprived, such as employment, education, official housing. We Enactus Middlesex discovered that the refugee status takes a month to be granted, and during this period, asylum seekers have limited access due to education, social interaction, due to the lack of language and cultural barriers. English deficiency can therefore lead mothers having difficulty finding support for applications such as new housing and employment that works around childcare.
We Enactus Middlesex wants to work with mothers who are waiting for their refugee status. We are planning to run small English-speaking workshops in group of 2 to 4 people that will last 2 hours in order to help the mothers minimize language barriers and fill in important applications. We are planning to hold the small workshops in one of our university conference rooms, and we will have staff from our project partners helping us deliver. We will be using the conference room projector and computer to deliver our small English-speaking workshops. Refreshments will be provided, and we are willing to commit at least 2 hours a week to prepare our workshops.
We are in the initial state of negotiations with both our project partner, Barney Refugee and Young Roots. We have spoken to Elias from Barney Refugee, who agreed to have a brief meeting with us face-to-face. Meeting with the councillor of Barney, Mr. Thompson, is also scheduled in the coming weeks. However, due to current unfortunate global circumstances, our meetings have been rescheduled for a future date, possibly by the end of April. The English one-to-one mentoring support will focus on key vocabulary for application forms, for example, children benefits, one-to-one application form support, and knowledge about British culture. Our team is multicultural and internationally bilingual. That will help us to communicate with the beneficiaries. We also aim to recruit students, volunteers to provide support to our target audience.
The impact that we are looking to achieve is to support asylum seekers with the improvement of their English language skills whilst waiting for the refugee status in the UK. Asylum seekers receiving English language skills from Relingo can have better access to services while they are waiting for their refugee status. Through Relingo, our beneficiary group can have increased stability and opportunity to move forward with their lives, decrease isolation as a result of language barrier, improve chances of gaining employment, and a better awareness of British culture. The way that we will measure the impact is by the number of female asylum seekers in mentoring relationships with a volunteer, increase independence completing UK administration and application forms, increased number of social outings in the community, and finally, the ability to access local services such as baby child groups and doctor visits.
In the next 3 months, we will have face-to-face meetings with the Barnet refugee and the young groups to inform them of our pilot. In the coming 6 months, we will finalize our agreement with one of the project partners about launching the pilot. We will then conduct the workshops in the partner's allocated space. We also aim to recruit students from university for this project. In 1 year, we plan to run a Relingo session during the summer from July to September, working with 2 to 4 asylum seeker mothers. These workshops will last for over 2 hours depending on the need of the beneficiary group and will then be tailored from their feedback.
This year, we have laid the foundation of an Enactus team in our university, and together have overcome many obstacles. Enactus Middlesex is becoming a new and exciting force of change for sustainable and social development in the community of Barnet. We are Enactus Middlesex.
We'll now begin the question and answer period. How has the team laid a sustainable foundation for the future?
As this was our first year, we were making mistakes as we went, but it was also a very good learning experience for us. And this year we've understood what it is like to delegate tasks responsibly and managing to work together to get things done on time. We've also gotten a good understanding of what Enactus projects are like, and we're looking to improve as much as we can by the beginning of next year.
I believe so that the way we will make them sustainable was not our first approach initially, because we took them in the manner that we created a project and then we started to look around for our beneficiary group. But moving on, we will make the change and look into the beneficiary groups and then cater to their needs. Making it financially sustainable would be through raising like fundraisers and also having multi-stakeholders involved in our projects.
How does the team display a true understanding of the Enactus criterion in their projects and project plans?
Okay, so in the projects, I believe we understand that the expectations for Enactus is for us to not make it completely financially viable for us, but rather have a value given to people that we're trying to help, whether it is 2 or 4 or hundreds of people. But the thing that matters most is the impact we have and the quality of work we put in rather than the quantity. Yeah.
How has the team displayed enterprising qualities such as a can-do mindset, the ability to turn ideas into reality, learn quickly from mistakes, and the drive and passion to succeed?
Though our team was very going through a very difficult stage as members were like dropping out in the middle, we remained resilient and we were keen on working and we never gave up. In this sense that we kept moving on and we tried to communicate to people around our area and getting to make Enactus much more knowable society within the university and the area around the university.